Today we're going to talk about the difference between teeth tomorrow and mini implants. I'm sure you guys have heard a lot about mini implants. It's sort of a buzzword nowadays. There's nothing magical about them. They've been around for probably 15 or 20 years now. The whole concept is that the implant is smaller in diameter. So regular conventional implants are probably around 4 millimeters or greater in diameter. Mini implants can be as small as 1.8 millimeter. 1.8 millimeter is tiny, so this is a model that shows mini implants. They're little tiny little screws. So the concept of mini implants is that the implants are placed without cuts, without surgery. That's sort of what they use to promote or sell this concept. But the problem with mini implants is they have a lot less what we call bone to implant contact. So the implant is very tiny, and when a small implant heals, there is less bone in contact with an implant. So in function or during load, these implants don't hold up as well as traditional or classical implants, because classic implants have a lot more surface area that holds them in your jaw. So mini implants support overdentures. So there's an overdenture, there's mini implants, and it snaps on. So it's a snap-on denture. The problem with that is that the denture will continue to move in the back. So the denture is still removable, and it will move up and down when you eat, and it will move side to side when you eat, and the mini implants will help a little bit retain the denture, but they do nothing for support. So the denture still sits on your gum, and when you chew, you're still gumming your food through the denture. That's the part that a lot of times people don't understand. So you're still gumming your food, you're still putting pressure on the gum. What it does is it hurts. What it does is it leads to bone loss. So what's the solution? How do we address all these issues with overdentures and mini implants? Teeth tomorrow is the concept. This is what we do in my practice. So the difference with mini implants is this is built on classic or full-size implants. This is a lot stronger. This is permanently attached to the implants so that nothing has to be removed for cleaning. Nothing moves there during function, so when you eat on this, the chewing force, the chewing pressure is greater than what you had with your own teeth. Where when you chew with an overdenture, mini implant overdenture, you limited to how much pain you can take, basically. When you bite on something, you're going to hurt yourself at some point because you're chewing on the gum. So when you bite on a chewy or hard food, you will pretty much stop at some point. Where with this, you don't have to. So with this, you can bite into your steak or corn or apples, anything you want, and you won't feel any discomfort, because it's totally supported by an implant. It's not sitting on the gum. So that's another big difference with mini implants. And obviously the appliance is made of a very strong material, zirconia. It is more hygienic. It doesn't require removal for cleaning. You can just brush it like normal with a toothbrush. We also suggest a water pick. But these are the main differences between mini implant overdenture and teeth tomorrow. And teeth tomorrow is definitely the way to go. Hey everybody, thanks for watching us today. It was great fun presenting different options to you. Again, my name is Dr. Kaplansky. If you're looking for a solution for missing teeth, whether it's a single tooth or a full arch of teeth or a full mouth of teeth, we are here to help. Give us a call. My practice is in Gasport. The number is 716-772-7500. And thanks again for watching.